outlines the evidence that children are disproportionately affected for the first time in a cognizant authority report. And then it evaluates in a critical way with a health lens a number of interventions that people have proposed and ask the question, do they meet the target of robust behavior? In other words, do they really work? Do they make a big difference if investments are made in them, and do they meet the needs of important stakeholders? So I'll just call out a few of them. One of them is that we understand that we have to assess exposure to mycotoxins in Africa and Latin America and parts of Asia for not just aflatoxin, but for the other toxins that are present, certainly fumonisin. And the reason for that is that the WHO has already said that fumonisin by itself, it causes reproductive health effects, and that fumonisin mechanistically interacts with aflatoxin. So if you lower aflatoxin in the food without dealing with the fumonisin, you won't necessarily get the health care gain that you're looking for. The second thing that we thought was very important related to the development of cheaper and more available biomonitoring technique. Measuring in crops is all very nice, but it doesn't help a public health person know whether you've achieved the goal that you've promised for the agricultural experiments that you're doing. And the third thing I want to call out is that we felt that there was a lot of need for basic research on what knowledge translation. We all know how we do it in our own countries, in the EU, in the United States and Canada and so on, in a certain context. And what we found is that we need gender-specific knowledge to better message this complex information, especially to the 60+% of Africans, let's just say, that live and produce their grain on smallholder farms. And that, although we have produced lots of knowledge translation information, knowledge that's actually culturally adapted, that is gender-oriented, is still missing. So those are three really important things that I would say about our report, and I encourage you to read it. It's online in English, French, and Spanish at irc.fr. Well, of course, so the question about donor coordination, I mean, that's certainly above my pay grade. But what I would say is that I think that we need to respect each other's abilities. There are researchers in the EU, for example, I've said in public and was quoted in the Science magazine, Science Journal item about our report, that the EU researchers have notably made an important contribution recently in biomonitoring in African populations, and that was critical to answering the question of why are we talking about this now. So that's a skill that Europe is invested in offering, is that Canada has particular strengths, the United States has particular strengths, and the European Union has researchers with particular strengths. It'd be my advice, based on, especially on the mycotoxin, because I was involved in the MicroRed initiative, the two MicroRed initiatives, and I'm involved in one MycoKey that's based in Italy, that I think there needs to be a European recognition that better actual functional incorporation of our respective skills, as opposed to putting names on proposals, would make a big benefit to synergizing our mutual activities. We have different skills from our different agricultural and public health orientations, and so if you ask the question, can we work together better, it's easy to say yes, but I've been rather more specific. I think the European Union needs to think about that more critically so that we can devise joint actions that move things along in a faster way.